I talked about the governor this morning. Stood up and said, mandates are important. That's the only way you're going to prevent this job lock he's been talking about today.
Job lock?
Job lock. You lock into a job because you're afraid to lose your health care. He said mandates are important to prevent that.
I know a lot of unemployed people that wish they had a job lock.
It sounds bad.
For some people.
Any comment on that?
I don't know what that meant. I don't know what the governor said. I don't understand. I don't understand. I guess I don't. Maybe you understand what that means.
Okay. Secondly, showing
Something about portability.
You're having a job that maybe you don't like because it's got really good health care, but the job kind of sucks. So
like
you
guaranteed media.
It's like being in the legislature. Yeah, like being in the legislature. Yeah, I mean, yeah.
We want to stay. We want to stay.
I don't know what the point. The point is though. Okay, so what's the point? We need health care so that we can avoid the job lock.
I'm not sure you had a point.
Okay.
He
said universal coverage is essentially portability. You can go anywhere.
What I learned from John Burton is don't answer somebody else's question. We all want to ask the governor for clarification on that. I talked to him yesterday. Senator Prada met with him yesterday, and he seemed to be in pretty good spirits.
Yeah.
Can you tell us then how this bill, that the newly crafted bill that you got together, what are the key differences between that and the governor's concept of shared responsibility?
I like the way you phrase that question. The governor's concept, with an emphasis on concept, because the governor doesn't have a bill. And we agree. I mean, in my bill, I call it, I look at every role that people that share in this community have to play. And the way I look at it is I said, you know what, we all have a role in this. The governor says it's shared responsibility. That's fine. I think our bill is pretty consistent with the concept of shared responsibility. Everybody has a role to play here. Everyone's got to tighten their belt. The providers, meaning doctors and hospitals, the insurance industry, workers got a responsibility, employers have a responsibility, and state and federal government have a responsibility. So I guess one could say ours is consistent with that value of shared responsibility.
You also can't expect people to be responsible if you don't offer them an opportunity to be responsible. And there's so many people just shut out of the system right now. So I think conceptually there's no disagreement at all between the governor's ideas about health care reform and what this bill does. And we're hoping that we'll now get even more focused on discussing it, because obviously if it goes downstairs, and we are very confident that it will, it's got to be something that he's going to feel comfortable signing. It is an important point that this made. We've really been dealing with a gubernatorial concept, which has been very hard to pin down because there's no printed word, and it's just like with the ERISA question. You can look at ours, lawyers can look at it, give an opinion, which they have, which we're basing on our work product on. The governors may have any number of problems, but as long as it's not in the bill, it's not a problem.
What is an individual going to have to do differently? If this were to become law tomorrow, what would, a plumber in Antigua have to do differently than he already is doing now? Just sort of
Union plumber or a...
you just put it sort of on a personal level for what just a regular Joe is going to have to do differently.
Well, let me just tell you, if somebody is let's say a plumber is working in a company that has 10, 15 employees, the owner of the company says, I'm participating in the pool, that plumber will not pay more than 5% of their monthly gross income towards the cost of their health care coverage. That's a pretty good deal for most working people. And it also says that if that plumber has a kid who doesn't have health care insurance, that child is going to have automatic health care insurance, universal coverage. And so that's what it means for that worker in particular. But what it means for 70% of California's uninsured population is that they will now go from being in a universe of not having any health care coverage at all to having health care coverage. And what it means for people that currently have health care coverage, that are forking out so much dough every month for their premiums, is that we're going to contain the cost of the health care system so that their premiums don't continue to exceed the rate of inflation as they have in the past. I mean, any business model, when you look at it and see that the costs are rising at 2.5 times the rate of inflation, talk about a business model on its way to crashing and burning. That's what's happening in our healthcare system, and so we're going to fix that with this. And so it's not only the 70% that we're going to capture that are uninsured, it's also the people that have insurance that are going to benefit from this, because they're going to see their insurance premiums, if not go down, at least stabilize.
Mr. Speaker,
We just have time for a few more, and then we're going to turn it over to David and Sumi for background to talk about details.
Yeah, they do.
you mentioned the 5%, that's only what refers to low-income people, is that correct, 5%?
Yeah, this is for the pool. I mean, I think
I don't think a plumber probably fits into the low-income category.
Yeah, I think the plumber does. If the plumber makes $62,000 or less, if the plumber is at 300% of poverty, which most plumbers are, if they don't have health insurance, they'll get coverage.
Well, the more
if they're a
serious-
union plumber, those guys make those guys actually do better than you and I, most union plumbers.
The more serious question is, you opted in this thing for the employer fee, it's still 7.5%, I presume?
Yes.
Okay. That could be adjusted by a board rather than being fixed. Wouldn't that, having that an open-ended thing, would that not encourage more opposition from employers and therefore raise the likelihood of a referendum?
Well, we're going to work with the employer community to address that issue. We don't want it to be an open ceiling so that Mr. Mibb says, okay, let's increase rates to 20% for employers. We don't want to see that happen. But we also don't want to lock it in as to not allow for an adjustment for cost of living and for them to be able, for Mr. Mibb to be able to put a product together for everyone.
But if healthcare costs are going up so dramatically, as you said to her, how do you put a ceiling on that?
Well, healthcare, that's the whole point of this effort, this joint effort between Senator Perata and myself, is that when you look at this bill and you look at the modeling that's been done by the Harvard-educated economist that's working with us on this, is that the savings that we're going to generate just by doing these reforms is going to help contain those costs, so that the escalating healthcare insurance premiums that we're seeing now are going to come to a screeching halt once these bills are implemented. By the way, Senator Perata's bill would have gone into effect in 2011. My bill would have gone into effect in 2010. Now this bill, our joint effort, will go into effect in 2010, which means a lot of work needs to be done on the front end, but we're concerned that we want to see the cost of health care stabilize in the state.